I think the other groups have validated similar results to ours, that you can detect tumor DNA in blood using different types of approaches. They've been able to identify mutations that correlate with what's in the bone marrow with different levels of sensitivity. So some of the tests may be more important for research purposes. The platform we're developing may be more clinically applied. I think it's going to take time for people to feel comfortable about moving away from a bone marrow to the blood test, but I do think that it is really the way of the future, and I don't think it's going to actually be that long before we will be able to do far fewer marrows and still get a lot of information from the blood that will impact patient care. I think it all has to do with how the depth of targeting sequencing is very important. So if you can sequence very deeply, then you're more likely to pick up the alterations that you're interested in. I think if you have low depth sequencing, obviously then if a patient does not have high tumor burden, you may not get your answer. So I think those importance, the amount of blood that you need to get from patients is also very important. So I think there's still lots of optimization that need to be done for us to be able to really say that this can replace bone marrow. But I really do believe that there will be utility for it in replacing bone marrow in certain circumstances.